Hello, my name is Maria and I'm a speech and language therapy assistant in the head and neck oncology team at St James's Hospital in Leeds. During the following presentation, I will aim to provide some general information about swallowing for people undergoing radiotherapy and or chemoradiotherapy treatment for head and neck cancer, and the role of speech and language therapy in managing swallowing difficulties. So throughout the presentation, I will try and guide you through some of the slides that you can see in the video and explain things in simple terms and sufficient detail. So to begin with, you may be wondering why a speech and language therapist is involved in your care, especially if you do not have any difficulties with your speech or voice. What the majority of people understandably do not know is that speech and language therapists have a broad role that includes supporting not only communication difficulties, but also swallowing difficulties. We know that head and neck cancer and the treatments offered for this type of cancer, such as radiotherapy, can impact swallowing and communication. Speech and language therapists are involved in your care to support you with managing any problems that may arise throughout your treatment with both communication and swallowing. The focus during the presentation will, however, be on swallowing, as it is a more common issue for people undergoing radiotherapy for head and neck cancer. I'm hoping that by the end of the presentation, you will know the answers to the following questions, such as: what does normal swallowing involve? How can my swallow be affected by radiotherapy? What are the impacts of swallowing problems? How can a speech and language therapist help? And what is the likely long-term swallow outcome? So let's talk about normal swallowing and some key structures that are involved in a healthy, functional swallow. So some of these structures that you can also see in the video at the moment are lips, teeth, tongue, roof of mouth, throat, voice box at the top of airway, as well as windpipe leading to lungs and food pipe leading to stomach. Throat is a shared space for where the air passes to reach the lungs and where food, drink and saliva pass to reach the stomach. Normally, the airway is open and food pipe is closed, so we can breathe. However, this changes slightly when food or drink are added to the mix. I will explain this later in a bit more detail. So swallowing starts in our mouths. We call this oral phase, and it involves being able to open the mouth wide enough or to seal the lips to a cup or a straw, to bite, chew and move food around in the mouth in a controlled way, to mix it with saliva so it is able to slide through the throat and food pipe, and to taste it. Once food is formed into a ball ready to swallow, it is pushed back to the throat where it initiates a swallow reflex, makes the throat close the airway, open the food pipe and squeeze the food, drink or saliva through the throat so it is all clear when the airway opens again. Now let's talk about what can go wrong with swallowing. Swallow can be affected during the oral phase in the mouth by things such as loss of food or fluid out of the mouth or over back of the tongue, pocketing of food or fluid in parts of the mouth, difficulty chewing or moving food around and forming a ball, and difficulty getting the food or drink to move back to the throat. Even though all of these issues I've just mentioned that happen in the mouth are unpleasant to deal with and can affect swallowing, What speech and language therapists worry about a lot more is what happens in people's throats when they swallow. Sometimes, as a result of radiotherapy treatment for head and neck cancer, food or drink may start going the wrong way into people's lungs rather than their stomach when they swallow, and this is called aspiration. It is important to be aware of and able to identify the following warning signs throughout your radiotherapy treatment that can indicate that this is happening, which will enable you to seek support from doctors and speech therapists as soon as possible. So these warning signs that can sometimes indicate that food or drink are possibly going the wrong way are coughing and spluttering when eating and drinking, shortness of breath, wet or gurgly sounding voice following food and drink, food or drink sticking in the mouth or throat, and chest infection or symptoms indicating a possible chest infection, such as a spike in one's temperature. Now, you might be wondering why we worry about swallowing problems. So the reason why speech and language therapists worry about food and drink going the wrong way particularly is because food and drink that have accumulated in the lungs can result in what we call aspiration pneumonia, which is a severe chest infection. We work very closely with doctors to identify any concerns regarding swallow safety as early as possible to prevent this aspiration pneumonia from happening. Weight loss and dehydration are also serious difficulties that we aim to avoid. That's why we work closely with your dietitian to identify and problem solve when swallowing difficulties are getting in the way of sufficient nutrition and hydration. We also recognise that eating and drinking is normally a great source of enjoyment for most people, and often our social lives revolve around eating and drinking. Your treatment and recovery period may be a difficult time to maintain motivation for eating and drinking when it is no longer a pleasurable experience. This is something your dietitian and speech therapist can also support you with. So, in addition to everything that I've outlined so far, there are also a number of other factors that may end up affecting people's eating and drinking as a result of radiotherapy treatment. The majority of them are listed in this slide that you can see right now and include things like taste changes, ulcers in the mouth and throat, thick phlegm, nausea and pain. Radiotherapy side effects that I've just mentioned usually do not occur until a few weeks into the treatment. However, different people react to radiotherapy in different ways. The radiotherapy team, including nurses, oncologists, dietitians, and speech therapists, usually work together to help people manage or work around some of the side effects as much as possible. So please seek support from these professionals whenever possible and tell them about what you are experiencing. You might be wondering what it is exactly that speech and language therapists do when they are assessing your swallow or helping you with some swallowing difficulties. So speech and language therapists are usually involved in your care throughout your radiotherapy treatment, depending on your needs. They may watch you eat and drink, listen and feel your swallow, and this is usually enough for therapists to assess your swallow. However, occasionally additional swallow tests may be carried out if needed, such as an X-ray of swallowing or a scope with a camera through your nose. Speech therapists may also advise various strategies to help with safe swallowing, which involve modification of texture of food or thickness of drinks, as well as postures and other swallow techniques. Swallow exercises are also often recommended to keep swallow muscles working properly. If your swallow does get affected by radiotherapy treatment, you might be wondering about the long-term swallow outcome and what your swallow might look like weeks or months post-treatment, or how quickly some of the difficulties that you might be experiencing resolve. Acute side effects that impact swallowing tend to persist for a few weeks after treatment finishes, and then usually fully resolve in the coming weeks or months. The swallow may take many months to improve and may also require specific rehabilitation, and for some people may not return to normal, unfortunately. For some people, long-term feeding via a tube may also be necessary. Occasionally, swallowing difficulties may unfortunately start or become worse in the months to years after radiotherapy has finished due to a late side effect called fibrosis, which is a stiffening or weakening of swallow muscles, resulting in difficult or unsafe swallowing. We are still learning about how we can best predict what someone's swallowing function will be like in the long term, and who is at risk of fibrosis and late swallow changes. So unfortunately, not a lot of information to do with these things is available at this specific point in time. Lastly, I'd like to talk briefly about the importance of good mouth care throughout your radiotherapy treatment and how it relates to swallowing. There are many different species of bacteria in people's mouth, and inhalation of bad bacteria from secretions in the mouth and throat can increase the risk of infection. Because of that, thorough oral care throughout treatment can reduce the risk of this infection. Oral care routine for people undergoing radiotherapy for head and neck cancer should normally consist of things like twice daily brushing of teeth, gums and tongue using a fluoridated toothpaste with a small-headed toothbrush, swilling mouth with saline a few times a day, especially after meals, cleaning dentures at least once daily and removing and storing them in water overnight, regular removal of oral dried secretions using a soft toothbrush, and regular sips of water throughout the day as long as it is safe to do so. Thank you for taking the time to listen to this presentation. I wish you the best with your treatment, and please do not hesitate to seek support from us if and when you require it.